suicidal behavior and don't know who to talk to about it. Maybe there's barriers in finding a psychologist or another mental health professional. Maybe we're not quite ready for that, but we are ready to open up to a loved one or a friend. And so I think that all of us can really play a valuable role, whether we're mental health professionals or not, in helping others who might be struggling with things like depression and suicidal thoughts. So I'm going to go ahead here and share my screen with you. I'll probably kind of jump around a little bit here and there. And if folks have questions as I go, feel free to unmute yourself and like jump in and ask. On my screen, I'm not able to see it if you like use the raise hand feature or if you type things in chat. But if you could just unmute and ask, that would be great. Otherwise, I'll leave time at the end too, if you want to talk. So I thought I'd share some basic information here at the beginning, some statistics, some risk factors, warning signs, and myths. But I do want to get to asking about suicide, because I think that's the part that many of us can really use in our daily life. So as I said, many of us have had our own experiences with this, have loved ones who have struggled. So I really encourage you to lean into self-care, both during this presentation and afterward as well. Use your resources if you need them. So if you're starting to feel kind of uncomfortable after this presentation, maybe reach out to a friend or a loved one. There's many different hotlines out there, other forms of support that you can access to. And I'm happy to share this PowerPoint with anybody who's interested as well. So I'll give you my contact information at the end so that you can reach out if you'd like it. So suicide is something that we find throughout the world in every population. So every age, every race, every gender, none of us are immune to suicide. So just some of the kind of statistics in Africa, we know that Africa overall actually has the highest rates of suicide worldwide. It is a big problem. The rates are estimated at about 11 per 100,000, but we also know that suicide is very underreported. So the rates are likely much higher than that. Here, there's a list of countries that have a particularly high prevalence of suicide in them. We know that about 8 to 10% of people attempt suicide. So it's not a rare thing, unfortunately. And in most countries throughout Africa, we find that older adults have the highest rate of suicide. But as I said, suicide is found in all ages. Within the United States, we find that some of our really high at-risk groups are middle-aged white males, LGBTQ individuals, particularly those who identify as transgender. It's high in individuals with disabilities, Native Americans, people living in rural areas, military veterans. There are some specific industries that people work in where it's also high, and then older adults, just like in Africa. I looked at some different research. This is by no means exhaustive, but I read a recent qualitative research study in Kenya that was looking at risk factors, and they found that many of the different risk factors clustered around interpersonal problems, like, a relationship ending, trouble with a partner, financial difficulties, mental health concerns, as well as religious and cultural influences. So these were some of the things that they found contributed to people's decisions to end their life. I also read some different studies that were done in South Africa. Those found that some risk factors were things like female gender, poor social support, mental health concerns like anxiety, depression, substance abuse. They found adolescents and young adults to be a high-risk group, individuals who had experienced sexual abuse or chronic illness, or who had lost a family member from suicide. So these are all things that make it, more likely that we might have suicidal thoughts, have suicidal behaviors, or ultimately die of suicide. But again, it can happen to someone who doesn't have any of these risk factors. A few more risk factors and things to share. These are all things we can be aware of, when we're looking out for friends, for family members, wondering how worried we should be, for example. In the US, we find individuals with a history of suicide attempts are more likely to attempt suicide or die of suicide again. Again, things like serious illnesses we mentioned, legal problems, having adverse childhood experiences, things like bullying. We also know things like discrimination, historical trauma, things like living in poverty and having lack of access to health care. There being a cultural stigma around talking about mental health. That can be a risk factor for suicide. And then having easy access to the means to carry out suicide, such as easy access to firearms, we found also could be a risk factor in the US. In addition to risk factors, though, we also have protective factors. And so these are factors that would lead a person to be less likely to die of suicide. And so these are things that we can really try to foster in ourselves and in others. So for example, protective factors that have been studied in the US related to suicide include things like having effective coping skills, good problem-solving skills, being able to say what your reasons for living are. So I stay alive for my kids, for my pet, for my partner. Having a strong sense of cultural identity can be a protective factor. A big one is social support. So organizations like Mental Health Unmasked that give us that social support, give us that connection to other people, just having that support itself can be a protective factor. Access to good physical, mental health care, having reduced access to means. So for example, in the US, we know that firearms in the United States are a leading cause of suicide. So efforts to reduce access to firearms have been found to be helpful. We also have having a cultural or a moral objection to suicide. So in individuals who come from cultures or religions where they believe that suicide is wrong, sometimes that too can help protect them against suicide. In addition to those risk factors and protective factors, we also have warning signs. So warning signs are things that we might notice in a person sort of in that time around.
Sorry.
Oh,
Hi, Jessie.
hi.
I'm sorry. I don't know. I was like, I don't know what to do. We're still on the first slide.
Oh no!
Yes.
Oh no! Let's see. I'll stop my sharing.
You want to share it with me, so probably I could help you
Yeah,
if you're
yeah.
comfortable with that. Yeah, I didn't know how to stop you. I'm sorry for interrupting the session.
No, no, please. I'm so glad that you did. Yeah, I don't
Yeah.
know why it wasn't advancing.
Okay. Let
Let
me.
me try again. And then if it still doesn't work, I can ask you to do it.
Okay.
Let's see here. Yeah, sometimes Google Meet is just not my friend.
Yeah, there's a lot with with technology.
So if I go through them like this, can you see me going through?
Yes, now we can.
Okay, so maybe I'll
Perfect.
just leave it at this then rather than doing the full screen.
Okay. Thank you very much.
Oh, sure, sure. So as I said, I'll give you all copies of the PowerPoint for anyone who wants it. Um, so I'll just kind of show you here some of the slides I was just going through. So you'll be able to look at these later if you would like. All right, so here's where we left off, which was warning signs. So warning signs are things occurring around the time of a suicide attempt or a death by suicide. So warning signs are really important because these are things that you can be looking out for among friends, among loved ones, among therapy clients, for those of you who might be mental health professionals. So, the other things, the risk factors, are things that maybe happened long ago or things that you might not necessarily know about a person. But warning signs are things that are easier for us to observe. And so, some researchers in the United States created an acronym called Is Path Warm. And so each letter of Is Path Warm stands for one of these warning signs. So the first one is ideation. So thoughts of suicide. So having thoughts of suicide is a big predictor, which kind of makes sense. It's a big predictor of the chance that a person might attempt suicide or might die of suicide. So we don't always know if a person is having suicidal ideation because they might not tell us. So what we can do, though, to understand if they're experiencing this is to ask them. And so in a couple of slides here, we'll talk about, well, how do I ask somebody about suicide? So suicidal ideation is one of the important warning signs we can look for. Substance abuse. So maybe a person who has been drinking more and more alcohol or using more and more drugs lately. That could be a warning sign of suicide. Just because we see that doesn't mean they're definitely going to attempt suicide, doesn't mean that they're even thinking about it, right? A person could use substances for many different reasons. But the more of these warning signs that we see, the more concerned we are that suicide could be a possibility. So we've got thinking about suicide, abusing substances. The next one is purposelessness. So this is where we feel like we don't have a purpose. We don't have a meaning in our life. And that can feel very lonely, to feel like we don't have a purpose or there's no point. Some individuals experience a lot of anxiety, which can be a contributor to suicide. They might also feel trapped, which is the T in Is Path Warm. When I say trapped, this could be a lot of things. This could be a person who feels like they're trapped in a relationship, who feels like they're trapped in a job that they don't enjoy, who feels like they're trapped in a certain area of the country. So that feeling of being trapped and not having options can sometimes lead people to suicide. Hopelessness. That's the idea that things aren't going to get better. And hopelessness is a big, big predictor of suicide. So a lot of us might feel depressed sometimes or anxious sometimes, but there's that part of us that thinks, well, it'll get better. Maybe tomorrow will be better, or maybe next month is going to be better. And that helps us to hang on. But when we're feeling hopeless and we're feeling like things aren't going to get better, that's when we might think, well, we don't have any options other than suicide. A person who starts withdrawing, so maybe they're not spending as much time with you as usual, they're just staying alone in their room a lot, can be a sign. Person having a lot of anger, a person behaving recklessly, so things like, driving too quickly, gambling with a lot of money, not really seeming to care about the consequences of things. And then finally, changes in mood. So a person seeming like they're not themselves. There's something different about them. And sometimes these mood changes can be that they're becoming more depressed and acting more depressed, but it could also be that they've been depressed for a long time and their mood has changed and suddenly gotten better. Sometimes we see that and we think, well, they're okay now. I don't have to worry. But in reality, sometimes that's when suicides happen, is when their mood has improved for a short period of time. And that's when they have like the energy that they need to carry out their plan. Or they carry out their plan before things can get bad again because they're worried that they're going to be depressed again soon. So all signs that we can look out for when trying to watch out for our loved ones. I also want to share some different myths about suicide because there's a lot of kind of incorrect information out in the world, out on TikTok, all that kind of stuff about mental health. So one myth about suicide is that people who talk about it don't actually die from it. And that's not true. We do want to get people talking about it so that we can get them help, but just because someone has talked about it doesn't mean that they're not at risk. They're still at risk. A myth that I often hear is that asking somebody about suicide is going to put the idea in their head, right? Like I'm scared to ask them about suicide because what if then that makes them do it? In reality, people know about suicide, right? You're not putting the idea in their head. They know what suicide is. They know it's out there. And in reality, by asking them about suicide, typically it comes as a relief. They're like, oh my gosh, like I haven't told anybody about this, and I wanted to, and I didn't know how. So asking them is usually very, very helpful and a relief. There's a myth that once someone makes up their mind, there's nothing you can do to prevent suicide. Again, that's not true either. Most suicidal crises are brief. They're time limited. So if you ask them about suicide, if you get them help, that will save their life. There's a myth that suicide doesn't have warning signs. In reality, it usually does. Typically, there are signs. It's just that we miss them. And that's why it makes it so important that everyone out there has basic knowledge about suicide, because when we know what the warning signs are, then we can look for them. Then we can help a person get help. If we don't know what we're looking for, then we're going to miss it. And the final myth on this slide is that when a person shows signs of improvement after a suicide crisis, the risk is over. And that is also not correct. Most people who die by suicide actually do so within 3 months of starting to feel better. And as I just said, sometimes it's because they have the energy, or because they realize it's probably going to get bad again at some point. So even when they seem okay, we still want to make sure we're giving them support. The last myth I want to talk about is that words don't matter. Words do. Words matter so, so much. And words can make a big difference in how we view suicide, kind of how we make sense about it, how we talk about it. So the words that I recommend to avoid using regarding suicide, the first one is commit. And commit suicide has been a part, certainly, of American culture for a very long time. But the reason that we don't like to use the word commit suicide is that commit often has negative connotations, such as committing a crime or committing a sin. Suicide, suicide is not a crime. And so sometimes when we use that word commit, it really stigmatizes the person who has attempted suicide. Or when someone loses a loved one to suicide and they hear that word commit, it often can make them feel negatively toward that person. And that shouldn't be the case. We also like to try to avoid using words like successful suicide, and also, on the other hand, like failed suicide, because it makes it sound kind of like suicide is a good thing, right? Like, oh, you were successful at that task. Good job. And there's nothing good about suicide. So instead of things like commit suicide, I recommend saying died from suicide or killed themselves. So I said that I wanted to spend a good deal of time here talking about how to ask about suicide. And I think this is so, so important because we can save a life. It shouldn't only be mental health professionals who know about suicide and know how to talk about it. If everybody in the community felt comfortable asking about suicide and knew how to do it in a way that would be effective, we could really reduce the rates of suicide in our communities. So I'm going to show you kind of a diagram here and some details about how we can ask about suicide in a way that is based in research, based in evidence. This is what professionals currently recommend for talking about suicide. So with the model I'm going to show you here, first, we have to just get into it by starting the conversation with somebody, which can be an awkward thing. So I'm going to give you some ideas on how we can initially start that conversation with somebody. Then we'll talk about how we can transition that conversation into talking about suicide. Then I'll teach you how to ask about thoughts of suicide, what to do if they say no, what to do if they say yes. Moving on, how to ask about their plan and their means. And again, what to do if they say no, what to do if they say yes. So let's start with this idea of starting the conversation. So if you have a friend or a loved one that you're concerned about, and you want to have this conversation, the first thing I suggest is just saying something like, can we talk? Finding a private location so that there's not a lot of people around, making sure that you have enough time to devote to the conversation and the other person does as well. And making sure that we're minimizing distraction, so we're putting away our phones, and that we're really prepared to listen attentively to the person. because we don't want to start this process and start talking about mental health and suicide and then be like, oh, I'm actually really distracted because I'm thinking about my final exam that I have later this week. We want to make sure that we're truly present for this conversation. So we could say things like, I wanted to talk to you because lately I've noticed that you haven't been coming around as much. You seem kind of sad. Uh, I've heard from work that you're really struggling at work, and I'm concerned about you. So we're sharing what we've noticed. We're expressing our concern. We can say things like, I care about you, and so I want to let you know I'm here to support you however I can. Or we could say, how have you been doing lately? It seems like things have been tough. What's going on? So of course you can put this in your own language. You don't talk just like I do, and I don't talk just like you do. But the key here is we're doing this in a place where we're both ready. We're not distracted, and we're telling them that we're concerned and that we care. Next, then, let's talk about how to transition this into suicidal talk. Transition it into asking about suicide. So, to transition, we could say something like, after we've talked to the person for a while, they've told us what's going on, we can say, sometimes when people are going through a difficult time, they think about harming or killing themselves. Have you been feeling that way? Or we could say, sometimes when people feel really stressed, like you just mentioned, or really lost, like you have mentioned, they think about suicide. Or we could say something like, has it ever gotten so bad where you felt like, I just wish I wouldn't wake up tomorrow. I just wish this would be over. So there's different ways, different phrasing you can use to kind of transition. But at some point, we want to make sure that we clearly ask this question. And the question is, have you ever had thoughts of suicide? Or have you ever thought about killing yourself? And that's a scary sounding question, right? Like most of us don't normally ask this question and ask it so bluntly and so clearly, right? But we want to phrase it in this way so that it's very clear, so they know exactly what we're asking. And I think phrasing it in this way shows that we're okay talking about it. We're ready. So that is how I recommend phrasing it. We want to avoid being vague when we ask. So if we say something like, have you ever thought about doing anything to yourself? Or have you been thinking about bad things? That's really vague, right? Like they don't necessarily know what we're getting at. And it kind of implies that we're not comfortable talking about suicide. We want to avoid slang terms as well. And we want to avoid really negative or pejorative phrases. So we don't want to say something like, you aren't going to do something stupid, right? Because if it's a yes, and they are thinking about it, well, who wants to answer yes to a question where they just asked if we're going to be stupid? Like, no one wants to say yes. So we don't want to do anything verbally or non-verbally that implies to them that we're really hoping they say no. Because what we don't want is for it to be a yes, but they look at us and they think, I don't think this person can handle me saying yes. So I'm just going to say no. So we want to say it very clearly, which is scary. It's a scary question to say. And so what I recommend is saying it out loud just to yourself. So like right now, if you happen to be in a location where you're alone or you feel comfortable just saying this question out loud, I want you to say it out loud with me. You can like look at an object you have, you can look at your water bottle or something and just ask your water bottle, have you ever had thoughts of suicide? Have you had thoughts of killing yourself? So anybody who wants to try it, now is your chance to try it. Have you ever had thoughts of suicide or killing yourself? And I'm guessing for those of you who just tried it, it was probably uncomfortable. And it is, it's an uncomfortable thing to say. But I think the more that we get used to saying it, even if it is just saying it out loud to our dog, to our water bottle, whatever it is, then when we say it in real life to a person who is struggling with these thoughts, it's going to come out easier. It's going to be better. So thank you for those of you who tried it. If you didn't try it, I encourage you to do so on your own later. So we've started the conversation, we've transitioned into talking about suicide, and we've said that question. Have you ever had thoughts of suicide? Or have you ever had thoughts of killing yourself? Now let's talk about what to do if they say no, and what to do if they say yes. So if we ask them that question, and they say no, I've never had thoughts of suicide. No, I'm feeling down, but no, never thought of suicide. What we don't want to say is, oh, good. I was so worried. Because maybe later it will be a yes. And you just said like, oh, good. Like, so we don't want to shut down the conversation. We want to make sure that they know that if it becomes a yes, we're there for them. And maybe if it really is a yes now, and they just weren't comfortable telling us, still, we're here for them. So they say, no, I haven't had thoughts of suicide. Then we can follow up by saying, okay, well, the reason I asked was because I noticed, and then we can share why we asked. Or, well, the reason I asked was that often when people feel like you do, they also have thoughts of suicide. Or the reason I asked was because I know it's really common for college students to have these thoughts. And then you can ask again, just in case that no is really a yes. So we can say, so have you ever had these thoughts? Or maybe have you ever just, wished that you wouldn't wake up? And they might say, nope, I'm good. Really, I'm fine. Or at that point, they might say, yeah, I have. So what do we do then if they say yes? Oh, sorry. Before I do that, if they still say no, like, nope, definitely not. We still want to let them know, I am here for you if later down the road it does become a yes. We can give them resources too. So we can say, okay, if things do get bad, here's the suicide hotline number. And then we can follow up with them later and check in. Because if we noticed stuff was going on with them enough to ask them about suicide, we should probably still follow up with them. Check in a week or something, make sure they're doing okay. If they say yes, that they have had suicidal thoughts, first thing we want to do is stay calm. We want to remember that suicidal thoughts are very common. So just because they have had thoughts of suicide doesn't mean it's an emergency necessarily. Doesn't mean anything horrible, but it does mean we need to ask some more questions. We want to know how bad this is. So if they say yes, they've had thoughts, we want to ask them if they have a plan, and we want to ask them if they have the means to carry out that plan. So we can say things like, have you thought about how you would do it? Have you thought about how you would kill yourself? Have you decided like when you would do this? Have you done anything to like prepare for it or to get the things that you would need in order to do it? So that's asking about the plan and means. So let's talk about if they say no to those questions I just asked, and what to do if they say yes to those questions. If they say no, no, I don't have a plan. No, I don't have access to any means to do it. I just have the thoughts, but I would never do anything about them. We want to respond and say, okay, well, I want to make sure you have the support that you need. I don't want to be the only person who knows about this and can help you, because I might not always be able to be there. So who else would you feel comfortable telling this to? So for example, maybe we help them to confide in their family or a partner or a mental health provider, because it's not on us to be the only person to know about this. We want to make sure that this person has the support they need. And that can't just be us. We're just one person. We can provide them resources. So we can maybe help them get connected to a mental health professional. And again, follow up with them. Hey, how you doing this week? You want to grab coffee? You want to talk? If they say yes, so they've said, yes, I have suicidal thoughts. Yes, I have a plan for how I would do it. And I have a plan for when. It's going to be this Friday, and here's how I'm going to do it. That is when we consider this to be an emergency situation. We need to remain with them and keep them safe. So you're not a medical professional, you're not a mental health professional for most of you. So we need to get professionals involved at that point. So it could be that you call a suicide hotline on their behalf, and like you both talk to them on speakerphone. That could be a nice way to support them and to get someone else involved. You could call your emergency services number. You could drive them to a hospital. And you can say things like, thank you for sharing that with me. Like, I'm sure this is really difficult to talk about. I care about you and I want to make sure you're safe. And since I'm not a mental health professional, I think it's important that we get some help for you. And it might be that they're getting upset with you, like, oh no, I don't want this to happen. I don't want you to call anybody. I often say things like, I'm sorry you're upset by this, and I know this is really scary, but I would rather have you be upset with me and safe than I don't do anything and something terrible happens. So that's why I want to get you help. So this is a lot. This is a lot to carry as the person who's trying to support this individual. This can be a really stressful situation. But if you do these steps, it will help you to know what to say, and it will help make sure that they get the help that they need. So I have some resources here. Findahelpline.com is a really, really good website that you can use in order to find resources for your country. So it'll give you all the important phone numbers that you can use, websites, all of that to get somebody help. So that findahelpline.com is one of my favorite resources. There's also a link here to some international suicide hotlines. There's some specific resources here in South Africa, as well as Uganda. And then here's some additional resources to just learn more about suicide and suicide prevention. And finally, you have my name and my email address. If you want to contact me for copies of these slides, especially since you couldn't see the first several of them, please do. If there's anything that I can do to help collaborate with your organization or community or anything, please let me know that as well. I'm always happy to help however I can. All right, so I believe that you should be able to see me now and not my PowerPoint. So I know probably some of you have to go. Some of you perhaps also have questions that you want to stick around for. And thank you, Patrick, for sharing your own experiences. Yes, yes, it is very, very challenging. And I hope that if you've been considering suicide, that you're getting the help that you need. There's a lot of really good resources out there. Do folks have questions for me or comments? You can feel free to ask in chat or to raise your hand. Let's see, is it pronounced Nibel? Niebel?
It's stable.
You know?
Yes. So my question is simple. I think the answer to it is simple, but it's confusing to me. So I wanted to know what's the difference between suicidal thoughts and ideations.
Great question. Yeah. So suicidal thoughts and ideation is typically viewed as the same thing.
All right, thank you.
Yeah, you're welcome.
Hi, Jessie. I have a question about you talk about the resources. Do you think it's appropriate to do you think it's necessary to have a discussion with someone who is going through like you talked about, like the drug abuse and things like that and the signs? And you think it's necessary to have a conversation first before sharing like resources, help resources for them, or do you think it's possible to just share resources immediately?
It's a good question. Yeah. I feel like it depends maybe on your relationship with that person. But I think you could do either. I think the helpful thing about having that conversation while you're sharing resources, so whether it's before or at the same time, is that it helps them to know why you're providing the resources. Because sometimes when we struggle with mental health, we don't see it in ourselves. Like we think we're handling it better than we are. We think we're hiding it. And so if you just give someone the resources, they might think, oh, well, I don't need these. I'm coping just fine. But when you say, here's what I'm noticing, you've been doing this, you've been missing out on this, it helps them to realize, oh, maybe this problem is bigger than I thought. Maybe I really do need to use some resources.
Yeah. Thank you. So that makes a lot of sense. Thank you.
Okay, thank you. Acha.
So I have a question. Um, I don't know if you have answered it, but I'd like to hear you re-answer it just in case. So, for example, we have a mental health and masked WhatsApp group. So if someone comes and they express that they're tired, that they don't know any way out, as a WhatsApp group, it's online already. Like, what steps do you think we should take?
Yeah, that's a great question. And do you have individuals from many different countries, I assume, in that?
Exactly. So we have people from South Africa, we have people from Morocco. I think we've had some from Liberia, then we have some from Canada and the US. So
Yeah.
it's a bit complex.
Yeah, so I think that website, that findahelpline.com website, would be good to just provide every week. That way, no matter what country a person's from, they can go there and pretty quickly find resources that are specific to where they live. If you know that there's a certain handful of countries that often have representation, you could maybe take the extra step of finding resources for each of those countries and making sure to provide those. Because one of the things that can be hard when we're struggling is to go through all that work of finding the resources ourselves. You know, when we're already depressed, it's so much, we're exhausted. So if you can just say, hey, you're from Uganda, here are my resources. That's going to eliminate a lot of barriers, I think.
Yeah, thank you. Okay, there are questions. I think Hattie put her hand up first.
Yeah, let's
Yeah.
see. Okay, let me just look. So in
Yeah,
chat, Ariana said, I have gone through depression and have been thinking of harming myself and have suicidal thoughts. Thank you for sharing that, Ariana. As I said, you know, depression, so common, suicidal thoughts, so common. I really encourage you, if you aren't already, to connect with a mental health professional or to check out those resources specific to your country at that findahelpline.com resource. Because, you know, I'm not sure, you know, your background or what's been going on, but getting you the help now, I think, is really important, and finding someone that you can talk to about it. And then you said, who was next? Was it Hattie or Ruth? Hattie? Hi, Hattie.
Hi, Jessie. Thank you so much for your presentation. I just wanted to really add that for Uganda, there are a lot of other reasons why, for example, families don't talk about suicide. So there's a cultural aspect of where dying by suicide is sinful. And so a lot of families are going to hide and they will not say the truth that their child or their loved one died by suicide. And that brings on that isolation where people are keeping this by themselves. They feel a lot of shame. They don't talk about it, that my spouse or my child died by suicide. And so you can imagine, like, your child or your spouse dies by suicide and you are hiding it. Nobody else knows the pain, the trauma, the guilt that you're feeling. And then secondly, actually suicide is illegal in this country. And so a lot of people are not going to talk about it when someone dies by suicide. A lot of churches are not going to have a funeral service for somebody that has died by suicide. The burial ceremony is going to look different if somebody dies by suicide. I've heard cultures where they actually beat up the dead body, literally. And so all of these other factors make this issue really loaded and difficult. Think about church services in this culture. It's really where people get comfort and support. And here you are, somebody, your loved one dies by suicide, your community is not around you, you're hiding this, you're feeling a lot of shame and guilt about it. So I just wanted to just add that part from a cultural standpoint in Uganda. Yeah.
Yes. Thank you so much for adding that, Hattie. Absolutely. The stigma plays such a big role and such a barrier in seeking help. Yes, thank you. Ruth, I think you were next.
Okay. Hi everyone. Um, Sorry I couldn't speak earlier. I actually had to walk to the washroom to talk now. But my question, I have a question. Um, how someone knows, because I think personally I have such crazy thoughts in terms of sometimes self-harm or sometimes wishing harm on myself. I don't know if we're allowed to share such things, but and so I don't know if those are suicidal thoughts, of course the harm ends in death because it's like I wish I could maybe jump on a huge knife. Okay, they're very scary thoughts, but they're also like what are these things that are fiction, right? Um, and I've been very sad before, but I don't like to call it depression because I feel like depression is a whole mental illness, and my sadness is I get in and out. But I was like, I just wanted to know when someone knows they're having suicidal thoughts because I've never, like, I never attempt, but the thoughts are always there. And in my head, I think maybe it's because I have like a wild case of dark humor. Maybe, maybe I'm just really funny and it's dark, but it's funny in my head. So, do I need therapy, guys?
Yeah, it's a great question, Ruth. I think, one of the things that that mental health providers often use to determine if a person could benefit from therapy is they look at, is it distressing and is it impairing in some way? So it sounds like you're distressed, sounds like you're uncomfortable with having those suicidal thoughts. So that's a good sign that you might want to see a mental health provider. And then they could help kind of dig in more and figure out, are these thoughts okay to just keep having? Are they thoughts that we should work on? Is it depression that you sometimes get, or is it something else? So a mental health provider would really be the one to be able to help dig into that. But I think for everybody, it never hurts to see a mental health provider. So the worst case scenario is you tell them what's going on, and they say, I don't think you need therapy. And then, yeah, you've like wasted an hour of your life, but at least now you know. And it might be that they say, well, maybe we think you're doing pretty okay, but we still think therapy could help, and here's how. So I think making that first step and just seeing if you could benefit could really help. Let's see, I'm seeing messages here in chat. Let's see. Exposure. Let's see. So other folks asking kind of individualized questions. So like, how do you handle a separation with a loved one who leaves you and you will never hear from again? Yeah, definitely. That sounds incredibly challenging, incredibly difficult. I don't know. I don't know how you would handle it. But I think if that's something that you're going through and you're feeling discomfort, you're feeling distress, whether it's depression, anxiety, something else, if it doesn't feel good and you're having trouble coping with it, that's the exact time that I recommend that someone seek out a mental health provider. Because that's what we're here for, is something's not feeling quite right in your life. Something's not going well, and maybe your existing ways of coping with it haven't been working. So yeah, I would say that's another vote for therapy. Other people, Mateo, saying that you've gone through your own episodes at a point. Yes. I hope you were able to get help for that. If not, I recommend reaching out to a loved one, getting help. Let's see, and then Asha, you mentioned, how do we reach out or react to such a situation that Dr. Hattie has pointed out? Like the stigma, or what piece of it?
I think it's in regards to like a family that has experienced someone. trying to avoid the word commit suicide. That's something I just learned today.
Yeah,
Gonna
yeah,
use
died of
died
suicide.
of suicide. Oh my gosh, thank you for that lesson. Like, I think one thing mental health and master has done is it has taught me how to verbally address situations. It's sometimes you don't understand the weight of words. Thank you for the lesson on that. But like, how do you stand up or like be available, be present for like a family or group of people that have someone that has died of suicide?
Yeah, that's a great question. Personally, I think talking about it is a huge thing. You know, um, being someone who's comfortable talking about suicide, rather than, ignoring it or pretending it didn't happen, because a loss to suicide is different than other types of losses. It just is. And so there's lots of like online support groups for people who have lost someone to suicide, lots of really good websites that can give you ideas about, what to say, what the grief process looks like. So I would say, in a situation like with that family, to be able to say, I'm here for you if you want to talk about this. You and I, we don't need to pretend that this isn't happening. It is. So if you want to talk, I'm here. I support you. Sharing resources. So if you can kind of, go online, do a search, find some information and give it to them, that could be helpful. Just anything where they don't feel as alone, because losing someone to suicide can feel very, very lonely.
Thank you so
Yes,
much for
definitely
sharing.
those warning signs. Yeah. And Karunda asked about exposure to content on suicide, like social media, if that can predispose someone. What we know is that from research is that in healthy populations, so in a person who isn't depressed and they don't have a lot of risk factors for suicide, they can be exposed to information and images about suicide and it won't impact them. So, detailed reports in the media or, movies, TV shows that have suicide in them, the typical person won't negatively be affected. But the person who's already struggling with maybe suicidal thoughts or has a history of attempts, they might see those things and it could negatively impact them. So like in the United States, we've tried to be very careful about how we report on like death from suicide. So for example, if like a public figure dies of suicide, the news reporters try to keep it kind of factual, not dramatize it too much. They often don't give specific details because we know that those details can actually lead vulnerable people to then die of suicide themselves. So yeah, how we report on things in the news media, how suicide is portrayed in TV and movies can make a big difference for vulnerable groups. Any other questions from folks? All right, well, I know we're over on time, but as I said, feel free to reach out